listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, CMS requires all calls for marketing, sales, and enrollment between agents and clients to be recorded. Keep listening to find the answers to your questions about the rules. FAQs about the Medicare call recording requirements, written by Roxanne Anderson and Emily Markovic. Do you have questions about recording and storing your calls to meet Medicare call recording requirements established by the Centers for Medicare and Medicaid Services, or CMS as we like to call them? Good news, we have answers. Today, we are answering some frequently asked questions about CMS call recording requirements. Joining me in the studio is Tina Lamoureux. She will be leading us with the questions, and I'll be answering with informed responses. Thanks for coming in, Tina.
Thanks for having me.
Now, quick reminder on compliance before we get into the FAQs. You must still follow all Medicare permission to contact and scope of appointment rules, including collecting a scope of appointment 48 hours in advance, unless a valid exception applies. For more information about compliance rules, check out the episode notes. Tina?
All right, we have a lot of questions to get through, but we'll start off with some general questions. When did CMS Medicare call rules go into effect?
These rules went into effect on October 1st, 2022.
Are there recording rules set by CMS or the FMO, such as Ritter and Integrity?
The rule is set by CMS. Ritter's interpretations of the rule are informed by those of the carriers we contract with. As your field marketing organization, Ritter Insurance Marketing is interested in providing you tools, resources, and support to comply with all CMS guidelines.
Do these rules only apply during the annual enrollment period?
No, these rules apply to all marketing, sales, and enrollment calls with Medicare clients.
What plans and products fall under the final rule from CMS?
Medicare Advantage prescription drug, Medicare Advantage, and Medicare Part D plans fall under this rule. So MAPD, MA, and PDP products fall under this rule for third-party marketing organizations, or TPMO sales call recording.
Does the call recording requirement apply to Medicare supplement, hospital indemnity, or ancillary products?
No, the TPMO call recording requirements are in place for Medicare Advantage with and without Part D coverage and standalone Part D plans. If you're calling for the solicitation of Medicare supplement or other lines of business, these specific guidelines do not apply, and you will not need to record. Please keep in mind, though, you must still follow all state and carrier guidelines for those lines of business.
What if a Medicare supplement product presentation and sale turn into an MAPD, MA, or PDP presentation and sale?
The Medicare supplement sales presentation does not require call recording. If the caller would like to discuss MAPD, MA, or PDP options, you must collect a completed compliant scope of appointment 48 hours prior to discussing their MAPD, MA, or PDP options, unless a beneficiary is 4 days or less from the end of a valid enrollment period. For example, the annual enrollment period, open enrollment period, special enrollment periods, and the initial coverage election period. In this situation, you must still collect an SOA before talking with the beneficiary about their options, and the call should be recorded. Agents shouldn't need to record calls to set appointments, but all marketing, sales, and enrollment calls need to be recorded. To the extent you can, we suggest that you record all calls with beneficiaries for your records and protection.
What if a client calls about a plan that I don't represent?
In this situation, we'd still advise that you record this call. It's likely that you'll be comparing the plan they are looking for with products you currently offer in your portfolio.
What Medicare calls need to be recorded?
According to the CMS 2024 final rule, call recording is limited to marketing, sales, and enrollment calls. Marketing includes retention marketing, aimed at influencing a beneficiary to stay enrolled in a current plan, as well as the mention of any benefits like dental, vision, hearing, premium reduction, and cost savings.
Now we're going to get into more specific scenarios about when call recording is required. The next question is, do in-person MAPD, MA, and PDP appointments and sales need to be recorded?
No, in-person meetings and sales do not need to be recorded.
If I talk to my client 3 times in one day, will they need to be recorded all 3 times?
Yes, if you talk to your client multiple times in one day, each call must be recorded and preceded by the TPMO disclaimer.
Do follow-up and check-in phone conversations with clients also need to be recorded?
No, agents should not need to record calls to simply set appointments or check in after sales. Marketing, sales, and enrollment calls are the only types of calls that need to be recorded per CMS. And again, marketing includes retention-based marketing or influencing a beneficiary's decision to stay enrolled in a plan. Marketing also includes materials that mention any benefit, including widely available ones, such as dental, vision, and hearing, premium reduction, and cost savings. However, and again, to the extent you can, we suggest that you record all calls with beneficiaries. This is to protect you as an agent should there be a member grievance at a later time and a dispute if the appointment was conducted in person or by phone.
If a client wants to receive their enrollment via email, do I just record the initial contact only?
Marketing, sales, and enrollment calls with your client should be recorded for the entirety, no matter whether the call is for a sales presentation or service-related purposes. If your call captures the sales presentation and then you email the client a link to your plan enroll page for the client to complete the enrollment, and the client chooses to finish the enrollment while not on the phone, that call recording would be acceptable.
Do calls made using Zoom or other online video chat applications need to be recorded?
Yes, any MA, MAPD, or PDP sales, marketing, retention marketing, or enrollment meetings not physically in person must be recorded. This includes telephonic, video call meetings, and other virtual telepresence methods. If you're having a video call meeting, we recommend muting the video call and initiating a recorded phone call to record the audio from that meeting. Only the audio portion of the calls need recorded, not the video portion.
What if I'm conducting an MAPD, MA, or PDP presentation or sale at Walmart or another retailer?
Since these sales are often made in person, no call recording is required. If you would continue any MAPD, MA, or PDP communication with that prospect telephonically, those calls must be recorded. Remember, you must collect a completed, compliant scope of appointment 48 hours prior to discussing their MAPD, MA, or PDP options, unless a beneficiary is 4 days or less from the end of a valid enrollment period, or there is an unscheduled in-person meeting initiated by the beneficiary.
Is recording necessary when I am holding a seminar for clients?
For a sales seminar, it's best to check with the carrier if they require any type of recordings, since they need to be registered with the carrier. Educational seminars should not be plan specific, so it should not need to be recorded. Any appointments following this event that are conducted telephonically or via video chat will need to be recorded.
We've talked about them on the show before, but there are a lot of great tools to assist agents with call recording, one of them being Integrity's Medicare Center. Can you tell us how inbound call recording works in Medicare Center?
The Medicare Center platform acts as a virtual operator, connecting the call between you and a contact, recording the call in the background. When the call is over, the recording will be available in the Medicare Center dashboard or the contact's activity stream. When a contact calls your Medicare Center agent phone number, the Medicare Center operator number calls the phone number you provided on your account. Your phone will ring, and your caller ID will display the Medicare Center operator number. When you answer, you'll be connected to the contact. You'll see an incoming call notification in Medicare Center, no matter where you are on the site or on the app. This notification shows you the contact's phone number and provides a link to a call recording disclaimer script with the CMS required disclaimers for you to read to the contact. There is no limit to the number of contacts you can have in contact management, and no limit to the number of recorded calls you can receive or place.
How does outbound call recording work in Medicare Center?
Once you've saved a contact in contact management, you can click their phone number in the contact record to place a recorded call to them at any time. Clicking their phone number tells the Medicare Center operator number to connect a call between you and your contact. Medicare Center's operator number will make the call to your phone first. Your caller ID will show your Medicare Center agent number. When you answer, the Medicare Center operator number will place a call to the contact, also using your Medicare Center agent phone number for the caller ID, and then connect you when they answer. The required call disclaimers will automatically be displayed in Medicare Center for you to read to the contact. When the call is over, you can find the recording in your contact's activity stream. You can make an outbound call from your Medicare Center agent phone number at any time to any contact, and it will automatically be recorded. Again, there is no limit to the number of contacts you can have in contact management, and no limit to the number of recorded calls you can receive or place.
What is a Medicare Center agent phone number?
A Medicare Center agent phone number is a free US-based phone number assigned to an agent in Medicare Center. The phone number uses a virtual operator that connects calls between the agent and their contacts. It records both incoming and outbound calls automatically. This number will not change unless you request it.
Where can I find my Medicare Center CRM phone number?
Your Medicare Center phone number is listed on your account profile page. Something important to note, if you're using your cell phone, make sure to add both your Medicare Center agent phone number and the Medicare Center operator number. That's 254-271-0085 to your phone contact list. This will help ensure that your calls are connected correctly and that your contacts have a good call experience. Additionally, if you had a Call Vault phone number and we set up your Medicare Center account for you, you will retain your Call Vault phone number for call recording in Medicare Center.
Do I automatically get an inbound call number for Medicare Center?
Yes. As a Medicare Center agent, you will randomly be assigned a unique, permanent US-based agent phone number. Calls made to and from your Medicare Center agent phone number are routed through your devices, like a cell phone, tablet, landline, or VoIP.
Do I have to pay for a Medicare Center agent phone number?
No, you are provided a Medicare Center agent phone number at no cost.
Can I change my Medicare Center CRM phone number?
If your Medicare Center agent phone number area code does not match your sales area and you have a different forwarding number that does, please submit that information to support@clients.integrity.com.
How can I change my Medicare Center agent phone number to a local area code?
Medicare Center will attempt to assign a number with an area code that corresponds to the phone number on your account. For example, if your account phone number has a Utah area code of 801, you will be assigned a Medicare Center agent phone number with area code 801, 435, or 385, all of which are Utah area codes, if there is one available. Medicare Center cannot create agent numbers with toll-free area codes. If the number on your account is toll-free, you will not be assigned a Medicare Center agent number until you update to a non-toll-free number. If your Medicare Center agent phone number area code does not match your sales area and you have a different forwarding number that does, please submit that information to support@clients.integrity.com.
How do I change the number my Medicare Center agent phone number routes to?
You can change the phone number that your Medicare Center agent phone number rings to by updating that phone number in your Medicare Center account profile. Changing your account phone number to one with a different area code will not change your assigned Medicare Center agent phone number.
Do I need to distribute the Medicare Center agent phone number to my clients?
Yes. You will want to distribute the Medicare Center agent phone number to your clients. Inbound calls will only be recorded if the beneficiary initially calls that number.
If I make an outbound call, will my contact see my name and number displayed?
Your caller ID will show your Medicare Center agent phone number.
Are inbound callers told they are being recorded?
Yes. Inbound callers will hear, quote, "Thanks for calling. Please hold while we connect you with your licensed insurance agent. This call will be recorded for quality assurance and training purposes." End quote. You, the agent, are provided a link to a Medicare call recording script with the CMS required disclaimers for you to read to the caller.
What if I don't answer the call? Is it still recorded?
Yes. All incoming calls are displayed in a call log on the Medicare Center dashboard, where they can easily be linked to a new or existing contact in contact management. To return the contact's call from your Medicare Center agent phone number, click the phone number in the contact's record.
What if a current client calls on my cell phone number? Do I have to call them back?
We recommend having your Medicare Center agent phone number easily available to provide to a client that calls on a non-recorded line. This will allow you to explain the situation and provide the number for them to call back on a recorded line. You can also get their name and information so you can call them back using the outbound recorded process.
What if I get a call from a client on a non-recorded line while on the road?
If you receive a call on a non-recorded line, it's best to let the client know that you will give them a call back and initiate an outbound call on a recorded line, or have them call you back at your Medicare Center agent phone number.
Can I link my call recordings to a contact in Medicare Center?
You can easily link your incoming call to a new or existing contact from the notification. You only need the contact's first name, last name, and phone number or email address to save a contact. But the outbound call feature requires a phone number on the contact record. Linking the call to a contact closes the incoming call notification and makes the recording available in that contact's activity stream. If the call ends before you've linked it to a contact, the incoming call notification will close and the call log will be added to the top of the activity stream in the dashboard. You can link it to a contact from there. Incoming and outbound recorded calls are displayed as activities, and incoming calls that are not yet linked to contacts are displayed as a call log.
What if I delete a contact?
Deleting a contact will cause you to lose direct access to their call recordings. Medicare Center can provide call recordings by request.
Let's move on to what agents can do if a client refuses recording. Is an opt-out available if my client doesn't want the call recorded?
No. If a client does not want to be recorded, you must organize an in-person meeting. If a consumer requests not to be recorded, you should end that call with the beneficiary and attempt another compliant outreach, like via email with opt-out function or via direct mail to set up an in-person sales meeting. While there is not a standardized Medicare call recording script to be said when a client refuses to be recorded, we recommend asking the client to state their name and confirm that they are refusing that this call be recorded.
What happens if someone does not want to have the call recorded, but there isn't the possibility to meet in person?
If a client or prospect requests not to be recorded, you should explain that this is a federal government requirement instituted to protect consumers, and all agents will need to record phone calls. If the individual still refuses the recording, you should end that call. Other options include communicating the requested information by email or mail. If that is not possible, you may need to forfeit that sale.
If a client refuses recording the call, can they just enroll over the web using Plan Enroll without any sales presentation?
Plan Enroll can be used to complete an enrollment online in an in-person capacity. It is still critical that you perform a full sales presentation, no matter if presenting in person, via email, or over the phone, to ensure that the enrollment being completed is the most suitable plan for that client's needs.
What is the penalty if MAPD, MA, or PDP calls are not recorded?
Penalties will vary based on the carrier. If the carrier finds repeated violations of this rule, it is the carrier's discretion to exercise any disciplinary actions, including the termination of the agent's contract. CMS may take direct actions in extreme cases that may involve the state's Department of Insurance, in which case the state may take the ultimate action, including revoking the agent's license.
If a client refuses recording and never wants to be recorded, do I have to continue the process every time I talk with them, or does a refusal last for as long as they are a client?
You would still need to walk through the recording and TPMO disclaimer each time on the call. You cannot use a refusal from one call as a blanket refusal for all future calls.
Can a form be signed that clients or anyone can opt out of this recording requirement?
No, you cannot use a refusal from one call as a blanket refusal for all future calls.
All right, we went over scenarios of what type of calls need to be recorded. Now let's move on to the language of compliant calls. Is there a call recording disclaimer script or wording agents must read to clients before proceeding with the recorded call?
Yes. An incoming call notification in Medicare Center shows you the contact's phone number and provides a link to a call script with the CMS required disclaimers for you to read. For outbound calls, the script will automatically pop up for you to read after you initiate the call.
What is the script that agents need to say?
The standardized TPMO disclaimer depends on how many plans you represent within a given geographical location. If marketing fewer than all plans within a service area, use, quote, "We do not offer every plan available in your area. Currently, we represent X number of organizations which offer X number of products in your area. Please contact Medicare.gov, 1-800-Medicare, or your local state health insurance program, SHIP, to get information on all of your options," end quote. If marketing all plans within a service area, use, quote, "Currently, we represent X number of organizations which offer X number of products in your area. You can always contact Medicare.gov, 1-800-Medicare, or your local state health insurance program, SHIP, for help with plan choices," end quote. For more information on when to use this disclaimer, review our episode, Insurance Agents as TPMOs, what CMS compliance regulations mean for you. We will have that linked in the episode notes.
Will consumers be confused by language within the Medicare agent call recording script and take it to mean I recommend calling Medicare directly for more complete service?
We understand an agent's concern with the disclaimer, both the mention about not offering every plan as well as advising them to check Medicare.gov. This is a requirement that was provided in the CMS Coverage Year 2023 Final Rule and refined in the CMS Coverage Year 2024 Final Rule.
Do the disclosures have to be read on every call with the customer?
The TPMO disclaimer should be provided within the first minute of every sales call with a Medicare beneficiary or prospect. Unlike the call recording that applies to all Medicare marketing, sales, and enrollment phone calls, the TPMO disclaimer only needs to be read for a sales call. The disclaimer does not need to be read for post-enrollment service calls, unless the call evolves into a plan change conversation, where the discussion involves sales activities or actions. In that case, you should initiate a different recorded call.
If I contract with every carrier in the area, is the TPMO disclaimer statement still necessary?
Yes, if you offer every carrier within a service area, you will need to announce this disclaimer, quote, "Currently, we represent X number of organizations which offer X number of products in your area. You can always contact Medicare.gov, 1-800-Medicare, or your local state health insurance program, SHIP, for help with plan choices," end quote.
Are there specific scripts I should use for plan presentations via phone call?
Consult with each carrier in terms of requirements for Medicare phone calls, as exact requirements on what must be said or discussed may vary from carrier to carrier.
One thing we haven't talked about yet. If we're recording these calls, agents are going to need somewhere to store those files. Where are the call recordings stored and how will I have access?
There are potentially two places you can find them, one of which is in Medicare Center. When the call is over, the recording will be available in the Medicare Center dashboard or the contacts activity stream. There's no limit to the number of recorded calls you can receive, place, or store. The second place is on the Ritter platform, which is why I said potentially two places. If you formerly used Ritter's Call Vault tool, which sunset in September 2024, outbound recorded calls are stored within a call logs tab in the client's record on the Ritter platform. Inbound Call Vault recorded calls are stored within the Calls tab of the Ritter platform.
Do unassigned inbound call recordings expire?
No, recordings from inbound calls do not expire. However, we strongly recommend assigning these recordings to the appropriate client record as soon as a call is completed for better archiving and management.
Can I download call recordings for my record?
Yes, you can download your call recordings at any time. However, please be aware that by downloading the recording file to your device, you are assuming responsibility for the secure storage and handling of any of the consumer's personal health information contained in the call recording. In Medicare Center, you can download call recordings from the contact's record or from the activity log. If you have recordings in Call Vault, copies of the recordings will be stored in the Ritter platform for 10 years as required by CMS. If exporting, you are responsible for ensuring the recorded files are secured to meet HIPAA privacy and security requirements and meet the CMS 10-year record retention requirement.
Can recordings be deleted?
If you delete a contact record from Medicare Center Contact Management, you will remove your access to any call recordings linked to that contact record. If you need access to a recording for a deleted contact, you will need to contact Medicare Center support. As far as Call Vault, recordings cannot be deleted. You can add a description to your recordings, so you could always note if a recording is not needed, like if you do a test call in the system.
How long will the calls be stored?
CMS record retention requirements of 10 years from the date of the call apply. You do not have to download any of your call recordings unless you've been requested to provide them to CMS or your carriers.
If I get 5 voicemail messages, would I have to listen to them and attach them to the correct client?
Yes, you would need to assign each of those calls to the appropriate client record.
Will the recordings be sent to the carrier along with the client's application?
No, the recordings will only be stored in your Customer Relationship Management System, or CRM. If a carrier requests the recording, you can download that call and send it to the carrier.
What kind of protections are there for these recordings?
Integrity understands that the privacy and security of agent and agency data is vital to our mission. Integrity software solutions deliver the security that you need for privacy, compliance, and the ownership of your own data that you deserve. Additionally, recorded Medicare phone calls are securely stored via Medicare Center, which requires a username and password for agent access. Medicare Center meets the privacy, security, and record retention requirements necessary to operate compliantly. More information can be found in the Medicare Center updated terms of use, and we will have those linked in the episode notes for you. Ritter Insurance Marketing ensures the security of all recordings made through Call Vault on the Ritter platform. You can review the security statement of our third-party partner, Twilio, which will also be linked in the notes. Additionally, recorded calls are securely stored via the Ritter platform, which requires a username and password for agent access. Call Vault meets the privacy, security, and CMS record retention requirements of 10 years necessary to operate compliantly. More information related to HIPAA privacy and security requirements, as well as the record retention requirements, can be found in the Ritter Docs compliance section on the Ritter Docs site.
How is a call recording transmitted to a third party if requested?
If audited by a third party, including carriers, you can download an audio file from the CRM. You can deliver the file to the company completing the audit by electronic communication, like email, file transfer, or file upload through a portal.
Next, we have some technical questions. How do I assign my unique Medicare Center agent phone number to forward to my office or cell phone?
You may assign your Medicare Center agent phone number to forward to the number in your account profile.
Must I be logged into Medicare Center to receive inbound calls?
No. If an inbound call comes into your Medicare Center agent phone number, your personal phone will ring and that call will be recorded. For the inbound call to be recorded, the requirement is that they need to call the CRM number. The client doesn't need to be in the CRM, and you do not need to be logged into Medicare Center at the time of the call.
Can I select to record a call if a consumer calls my mobile number?
No, the inbound call must come through your Medicare Center phone number for agent call recording.
If a consumer calls, does that number have to be verified?
No, there is no verification required for inbound phone calls.
Is recording equipment required to use Medicare Center call recording?
No, it is accessible through your current technology, like your laptop, cell phone, or tablet.
What if I experience technical issues during a call?
While we cannot guarantee that there will be no issues, we don't anticipate an issue with the recording capture or storage. Should an issue occur, you can contact your Ritter sales specialist for support and issue escalation.
Who is ultimately responsible if a call is not recorded? The carrier, field marketing organization, or agent?
Ultimately, the agent is held responsible. The carrier has the oversight, and thus agents are required to submit the required recorded calls in the event of an audit or a member grievance.
Am I calling through my computer, tablet, or through my phone when using the Medicare Center call recording system?
Calls are ultimately made through your phone. Initiating the outbound call from the client record within Medicare Center or an inbound call to your CRM number just provides a means to have that phone call recorded. Initiating an outbound call first entails receiving a call from the system on your phone. Upon accepting the call on your own phone, you'll be connected to the client.
Does Medicare Center agent recording work on all phones, like cell phones and landlines for outbound calls?
Yes, the call recording feature in Medicare Center works with all types of phones.
Do I lose the option to personalize my voicemail greeting for inbound calls?
No. When a client calls your Medicare Center agent phone number, the phone will ring to connect to your personal line. If you do not answer, they will hear your normal voicemail greeting.
Can I import recordings from another system?
Unfortunately, no. You are not able to import recordings from another system.
Can a recording be shared with two profiles? For example, a call is with both husband and wife at the same time.
No, a recording can only be assigned to one client record. You can add a description to the recording, noting that the spouse was also on the call as well.
If I already have my own CRM, can I just use it and be compliant?
Since we do not have information on your CRM, we cannot speak to this. You will need to ensure the CRM meets the HIPAA privacy and security guidelines. In addition, you will need to ensure the recorded calls are retained for 10 years.
What if I find out a call did not record after the sale has been completed?
First, ensure you followed the proper steps. Then, connect with your Ritter sales specialist to submit and escalate an issue to our software development team.
When the agent recordings are saved, will there be a way to tell if it was an inbound or outbound call?
Yes, It will state it is an incoming or outbound call recording in the activity stream.
We're at our final set of questions, the ones that don't really fit anywhere else. So here they are in no particular order. Can Medicare Center be used for all carriers, even carriers I'm partnered with through other FMOs?
Yes, all calls started through Medicare Center or received at your inbound number generated through the Medicare Center will be recorded. These recordings can be linked to your client's record and reviewed and downloaded regardless of the outcome of the conversation.
How might a carrier audit for non-compliance with call recording?
It's up to the carrier if they plan to do any type of periodic audit to ensure compliance with these rules outside of any complaints. However, if there is a complaint against an agent and the call was not recorded, that may negatively impact the agent and may result in corrective action.
If I use email to collect a scope of appointment and enrollment application, how is this handled on the recording?
If you're explaining plan options to the beneficiary strictly by email, then there is no phone conversation to be recorded. However, if at any time you're engaging in a phone conversation with the client, then the phone call must be recorded. Please be aware that the TPMO disclaimer is required on all electronic communication with the beneficiary, such as email. Also, when transmitting material with personal identifying information, or PII for short, you need to ensure the emails are being sent securely. You must also still ensure you're following the 48-hour scope of appointment rule.
Can I obtain a telephonic scope of appointment via Medicare Center?
No. Currently, there is not a telephonic scope of appointment incorporated into Medicare Center.
If a client does not speak or understand English, how should I proceed?
The TPMO disclaimer can be read by the agent in the language necessary.
How should I handle calls that are made by client representatives?
Calls to a client's representative should be recorded in the same manner as if you were speaking to the client directly. For storage purposes, we'd advise storing those calls in the client's record in the CRM.
Do outbound calls made by a non-licensed person to schedule a face-to-face appointment for me need to be recorded?
Per CMS, sales, enrollment, and marketing calls, inbound or outbound, with a client will need to be recorded. An outbound call made to the beneficiary to set up an appointment does not need to be recorded as long as permission to contact for Medicare sales has been obtained.
Does the call recording requirement apply to group Medicare plans?
Based on employer group waiver plan guidance from CMS, unless expressly stated as exempt, these requirements should apply to agents selling group Medicare as well.
What if I get the client's voicemail and leave a message, and no conversation ever took place?
If you initiated the outbound call in Medicare Center and you leave a voicemail for your client, the voicemail will be recorded and stored.
In order to use Medicare Center, do I need to input all of my clients or potential clients, regardless of whether they are enrolled through Ritter or Integrity?
You will need to create a contact in Contact Management to do the following. Initiate a recorded outbound call and assign to a client any inbound recording of calls received at your Medicare Center agent phone number.
Will I have to get a new phone number for this program that is separate from my current number?
Nope, you can keep your current phone number. The Medicare Center agent phone number will allow your clients to call that number and connect to your primary phone number on a recorded line.
Last question. How can I determine if a client has called my mobile number or CRM number?
For an incoming call to your Medicare Center agent phone number, you'll see the Medicare Center operator number, which again is 254-271-0085 on your caller ID.
We made it through the FAQs on compliant call recordings for agents. If you have a question that wasn't answered here, you can reach out to your Ritter sales specialist or email us here on the podcast at asgpodcast@ritterim.com. You can also find the link for frequently asked questions from CMS in the episode notes, along with all the other resources we mentioned today.
Thank you so much for listening. We will see you next episode.
The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. Script adaptation and recording by Tina Lamoureux. Additional recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen. Rate and review our show on Apple or Spotify.